So I would make sure I had the right patient by checking their ID band, and then I would start taking their vitals. I would start with their blood pressure, and it's usually systolic 50 to 70 over diastolic 45 to 30. I would get their heart rate by feeling their brachial or femoral pulse, and it's usually 110 to 160 beats per minute. I would take their temperature, and it's usually 170, I'll edit it out, it's fine. Their temperature is usually 97.5 to 99 degrees Fahrenheit. I would also get their respirations, and it's usually 30 to 60 breaths per minute. I would weigh the baby, and they should weigh between 2,500 grams to 4,000 grams. I would also measure the baby, and they should be about 48 to 52 centimeters. The head circumference, and it's usually 32 to 37 centimeters. The chest circumference is usually 30 to 35 centimeters. Next, I would move on to the head. I'd feel the fontanelles, make sure there was a small gap in between all of them for brain growth. I would then assess the head shape and make sure that it was symmetrical and that there was either, if it wasn't, it'd be molting or caput, which is both normal findings. Then I'd move on to the ears, and I'd draw a line from the inner canthus of the eye out to the pinna, top part of the ear, and make sure that was in line. I'd make sure there was no nodules or cysts on the ears. I would make sure they were fully formed and they were reactive to sound. Next, I would move on to the eyes. I would see if they were crossed or not, which could be a normal finding because of weak eye muscles, or it could be pseudostrabismus, which is fake crossed eyes. I would check for presence of an epicanthal fold. I would assess the sclera for its color, making sure there wasn't any hemorrhage or jaundice in it. I would also assess the pupils for pearla and make sure they were round, reactive to light, equal, and they were also reactive to accommodation. And I'd assess where the little opaque circle was. And then I would move on to the nose, and I'd make sure their mouth stayed closed, and then I'd check patency of each nostril. Okay, next I would assess the mouth, and I'd put my gloved finger in the baby's mouth, and I would feel the soft and hard palate and make sure it was intact. I would feel the baby's gums and make sure if I found any natal teeth, I would note that because that's a normal finding. I would make sure the tongue was midline, pink, and free moving and soft. And then I would move on to the neck. I'd make sure the neck was midline, and I'd make sure that there wasn't any webbing present. There was no masses or clavicular fracture. Next, I would assess the chest. I'd make sure the shape was normal, and I'd look at the appearance of it. I would also check the nipples and make sure they were symmetrical, and I'd make sure there wasn't any supernumerary nipples. That also is a normal finding if you did find them. I would assess the nipples and see if there was any discharge, which is also another normal finding. I would listen to the breath sounds next. I'd listen to it anteriorly, bilaterally, and then I'd listen also posteriorly and bilaterally. I would also assess the rhythm, and I'd make sure the nostrils didn't flare when the baby was breathing. Next, I'd move on to the hands and the feet. I'd make sure there was 5 fingers and 5 toes on each. I'd make sure there was no webbing, and on the hands, I'd assess that there wasn't a single palmar crease. Next, I would assess the skin, and I'd look at all the body and make sure that all of the skin, well, we're gonna restart that one. You don't have to end the video, but next I'd assess the skin. I'd assess the color of the skin. I'd see if there was any acrocyanosis, which is bluing of the hands and feet, which is a normal finding. I'd assess if there was any bruises, which is also another normal finding, and if I found any, I'd get the size, the color, and location of them. I'd assess if the baby had vernix caseosa, which is another normal finding, lanugo, which is the fine hair, milla, which is little dots on their nose, which is just build-up keratin. I'd also assess for birthmarks or forceps marks, and I'd assess the color, location, and if it blanches for birthmarks. The baby's skin could also appear molted. Next, I'd move on to the abdomen. I would assess the shape of the abdomen. I'd listen to the bowel sounds again in each quadrant. And then I would also assess the number of vessels on the umbilical cord. Then I would move on to the baby's genitals. If it was a female, I'd assess the labia, and it's normal if it's a little swollen. For males, I'd assess the scrotum, the penis, the urinary meatus, and make sure it's midline, and the testes, and see if they were descended or not. Then I'd move on to the baby's spine, and I'd assess that the spine was midline and straight and intact. I'd assess that the baby's movements were well coordinated and sporadic, and that there was no dimpling or tuft of hair at the bottom of the back. I'd move on to the extremities. After that, I'd make sure they had full range of motion. There were symmetrical movements, and I'd also look at the back of their legs, and I'd assess the length and make sure they were equal in length and all of the folds were symmetrical on each side. I would also do the Ortolani and Bartlow test to see if they had hip dysplasia or not. Next, I would assess the cardiovascular system. I would start by listening to the heart sounds, and if there was any murmurs or any innocent extra heart rhythms, I would note them. I'd also assess the pulse strength bilaterally in the femoral and in the brachial pulse. I'd get the lab values. Hemoglobin is usually 14 to 20, and hematocrit is usually 43 to 63. Next, I would assess the GI system. I would start by making sure there was no signs or symptoms of bleeding. I would assess the stool characteristics and the urine characteristics. I would assess the patency of the anus. I would assess for jaundice, and I would also assess the bowel sounds in each quadrant. I'd also assess their blood glucose level and if they seemed like they were hypoglycemic or hyperglycemic. For GU, I would monitor the baby's intake and output, their urine, and for females, if there was a pseudomenstruation, I would note that. For the neuro assessment, I would assess their alertness, their reflexes, their resting posture, their cry, their muscle tone, and motor activity. I would also do some of the primitive reflex tests. I'd also assess for no jitters, tremors, or seizures. The primitive reflex are the walking step, so you hold them up and they'll kind of take a little step. The moro, which is you'd startle the baby and see their reaction. Rooting, you would stroke the side of their mouth and they should turn in that direction. Tonic neck, you'd make sure they'd extend one arm and flex the other. I'd assess the palmar grasp, and then I'd assess the plantar grasp. I'd also do the Babinski test to see how they reacted to that. And then I'd also assess the suck and swallow reflex. Finally, I'd do the safety assessment, and I'd make sure the baby was on their back alone and they were in their crib. I'd make sure they had their ID bracelet on as well as the baby abduction bracelet on.